and thank you for joining us for our 6th annual Global Summit on Kidney Disease Innovations, Vox Populi. The time is now to prevent and cure kidney diseases. This summit is hosted by the American Association of Kidney Patients and in partnership with our allies from George Washington University School of Medicine and Health Sciences. My name is Candie Gagne, and I am an AAKP board member as well as an ambassador from Pennsylvania and a kidney transplant recipient. I was a hospital corpsman in the United States Navy and an OR educator before I had to retire because of kidney disease. Being part of the AAKP since 2017, I've been able to not only advocate for my fellow patients in the civilian sector, but also through the Veterans Health Initiative for the veteran population. This year's global summit, Vox Populi, was purposely and strategically chosen by AAKP for its historical meaning, the voice of the people. I am one of the people who has chosen to raise my voice in support of greater care, choice, and innovation in kidney care. And I am one of the voices demanding a change in the status quo kidney medicine. Over 850 million individuals across the world have kidney disease. This number is increasing at an estimated rate of 5 to 7% annually. Every year, we lose thousands of innocent lives to preventable kidney disease issues and the lack of timely access to treatment. AAKP believes both kidney disease is both a workforce and healthcare issue. The disease takes a devastating toll on human lives and livelihoods. Most people understand that kidney disease, left untreated and undetected, can lead to premature death. But many are not aware that it impacts a person's dignity and their ability to provide for themselves and their families. Kidney disease and outdated treatments can lead to unemployment, underemployment, disability, and dependency. In 2019, AAKP declared the next 10 years the decade of the kidney. The time is now for kidney patient consumers, healthcare professionals, researchers, industry, and all people of goodwill to unite our voices and demand change. We are optimistic we can and will save more lives. But to do this, we must demand new screening guidelines and diagnostics, new biologicals, and new devices. Together, we can manage and solve this growing global health crisis. The time is now for elected and appointed leaders worldwide to listen to patient voices. Governments must remove the regulatory and payment barriers they create that delay innovation and prevent timely care access. If government fails to act, we must raise our voices and demand an end to negative government determinants of health. Make no mistake, every nation is impacted by kidney disease, and millions of people are at risk. The optimistic news is that every person watching this program today can help those impacted by kidney disease and make an impact within their own nation. Although AAKP is educating patients, care partners, healthcare professionals, and policy leaders across the world on unmet patient needs. Our annual Global Summit on Kidney Disease Innovations has helped put a human face on what is now the 10th leading cause of death based on data from the World Health Organization. We have connected people across the globe in a common purpose larger than any one person or nation. Together, we have increased hope and optimism. So thank you for joining us. Your voice is the voice of the patient, and you can count on AAKP to keep amplifying it throughout the world to create change. With that, I'm honored to serve as the moderator for our session entitled Advancements in Dialysis Care, Home Dialysis Options. It is with great pleasure that I introduce our next speaker, Michelle Seger. Ms. Seger is a lawyer with Venn Strategies, a government relations firm in Washington, D.C. A strong advocate for increasing access to home dialysis, she currently serves as the policy director of the International Home Dialysis Roundtable, a global organization bringing voices together of people with kidney failure and clinicians in kidney disease and home dialysis space. She also works closely with the US-based Alliance for Home Dialysis. Ms. Seger previously served as a legislative counsel to Congressman Alex Mooney, and prior to that worked on the Judiciary Committee for Senator Chuck Grassley. Please welcome Michelle Seger to the program.
Thank you so much for the opportunity to be here today. I am really appreciative to Candie, to AAKP, and to George Washington University for having me back to speak at the Global Summit. I'm really excited to get into this program. I'm here on behalf of the International Home Dialysis Roundtable. Some of you might be familiar with our work. I have presented at AAKP before, and I'm really excited today to give you an update on all of the things that we have been doing at the Roundtable over the past year or so. So, who are we? What is the International Home Dialysis Roundtable? We are a group of champions for home dialysis. We have a really diverse steering committee. We have members from all over the globe that get together routinely. We make sure that we are talking and planning and executing new initiatives. The purpose of all of that to increase access to home dialysis. So everything that we do is meant to increase access to home dialysis. We are also the purveyors of a really successful series of global forums. The thing that makes these forums different is that we have brought together clinical and patient leaders, elevated all of their voices onto the same level, and work together to figure out ways that we can increase access to home dialysis. So patients and clinicians are talking to each other and making sure that we are able to really communicate in a way that can make a difference. And then we also work really hard to make sure that everybody that comes to our events knows that there's the opportunity to have their work in their local communities uplifted. So if there's a program that is potentially really successful and maybe even ripe for replication, we make sure that we are shouting it from the rooftops and talking to all of our members about what wonderful work is going on. So, how did we get here? We came into existence in 2020. The pandemic was in full swing, and folks really wanted an opportunity to talk to each other, clinicians, patients, other advocates, to figure out how can we advance home dialysis in the backdrop of the COVID-19 pandemic. Over time, as the pandemic sort of went in the rearview mirror in many countries, we expanded our focus from only COVID-19 to also other areas and other ways that we can make a difference for home dialysis. But what's really important is this paper, which you can see on the screen. The outputs of our first meetings were actually published in a paper in Kidney Medicine, and that's where we developed what we call our 4 pillars of advocacy. All of the work that we do centers around those 4 pillars that came from this paper. So on this screen, you can see all of our priorities in pillar form. So I will just run through them really quickly. They're international standards and cooperation, patient empowerment and education, a culture of support for home dialysis, and mitigating institutional roadblocks. And mitigating institutional roadblocks can actually include governmental roadblocks too. So, everyone after the first 2 summits that we held in 2020, everyone who attended, including our steering committee members, committed to working individually and as a group to advance projects under each of the pillars. And so, as I said before, everything that we've done falls under one of these pillars. So, the first thing that is on here is that patients are the heart of the recommendations in each pillar. This is 100% true. Without patient advocacy, the pillars wouldn't exist. There would be no point in doing any of this work. And so, under each pillar, we have specific areas where we think patient voices are particularly important. So you can see on here for international standards and cooperation, we're talking about tailoring our advocacy messaging. We're talking about making sure that patients and caregivers are able to share their stories no matter what region of the world they live in. We're also talking about education programs to help patients and caregivers really know how to be good advocates and know how to tell their stories in a way that makes sense to policymakers. For patient empowerment and education, I think it's pretty obvious. involvement of patients in home dialysis education. This is absolutely key. Home dialysis education is for patients, so of course it should also be by patients in many respects. Obviously, clinical information and clinician support is really key here, but so is patient. Culture of support for home dialysis. This is very similar to the first bullet on international standards and cooperation. We want patients to feel like they can tell their own stories, both to clinicians, whether it's their own clinician or other clinicians, and to policymakers. And then mitigating institutional roadblocks. This is about advocacy. So, how do we help patients know how to advocate with policymakers? How do we help caregivers tell their stories? All of this is really important, and we're going to talk more about it in the presentation. So, what I'm actually very excited to talk about today is our project for 2024, and that is the Patient Experience Survey. This falls under two pillars: patient empowerment education and culture of support for home dialysis. So, we're getting a 2-for-1 on this project. We're working in collaboration with AAKP. AAKP is actually one of our steering committee members, and I don't think I mentioned that before, but it's important to note. We are working with them to survey patients about their experiences with home dialysis modalities. In fact, we're actually working with them to survey not only patients, but also caregivers and family members so that we really get the full picture of everything that's going on related to home dialysis. Our goal here is to look and find common themes that apply to regions or specific countries. So, is there a specific educational program that's working really well in a particular region? Is there a barrier that we're seeing across a certain swath of countries that we need to address? Is there something that sticks out that needs to be replicated in other places? Then, once we figure out what those things are, stakeholders will be invited to develop advocacy or educational solutions to directly address whatever the survey shows. So you can see on the right here in the picture, this is what the survey looks like, just to give you a little bit of an idea. And if you are a patient, a caregiver, or a family member of someone on home dialysis or who has done home dialysis in the past, and you're sitting in the audience and want to take this survey, we welcome you to do that. And I think there will be an opportunity for you to reach out to AAKP or even reach out to me and make sure that that happens. Questions that are included in the survey really run the gamut. We're trying to figure out a lot of things. We're talking about education on home dialysis, whether people have really learned all that they need to know in order to be confident dialyzing at home, whether home dialysis is an affordable option and whether that changes depending on where in the world you're located, whether patients are confident in dialyzing at home and what makes them feel confident. How the choice of dialysis modality was made. Was that an independent choice? Was it made with family? Was it made with a doctor? The connection to fellow dialysis patients. This one's really important for advocacy. Do patients feel connected to each other? Is there room for growth? And then inclination to participate in dialysis related advocacy is the last one. And this is really important because this is where the action item comes in. Are you willing to tell your story? Do you want to talk to policymakers to make a difference and increase access to the modality that you care about? So we got some initial data back. The survey has only been open for about a week and a half, and we're really excited to report that we have 845 survey responses, which is huge. It's really interesting because most of our respondents actually identified not as patients, but as family members or care partners. Of the patients, most of them were in-center hemodialysis patients or CKD patients who weren't yet at the point of kidney failure to where they need a dialysis modality, but were still interested in learning about what their options are going to be. And I wanted to share a few impactful takeaways from the survey with you. Of course, as we get more data, because the survey is going to be open for another few weeks, this may change. So I want to give that caveat. But there are some things that I thought were really interesting to share with you. So the first one, most patients actually reported that they just decided what type of dialysis to do on their own. These patients didn't report deciding in conjunction with a clinician or in conjunction with their family or a friend or anything like that. They said they decided on their own what they were going to do. The next largest group said they decided alongside their family or their care partner. I thought that was really interesting because we talk a lot about shared decision making with clinicians, and patients. And I think this could be an interesting data point to look at when we're continuing to have those conversations. A large number of patients were not sure if home dialysis is an affordable option. Many of them cited a lack of government support in their own country and wondered if it was something that they could actually afford to do. This is really interesting to me because it leads to this policy that we've been driving towards. What policy changes need to happen in order to make home dialysis accessible? In some countries, maybe it's government support with budget for home dialysis, making sure that this is an affordable option. The top reason for choosing home dialysis was receiving useful information from a trusted clinician. And then, second, was the desire to maintain their own schedule. It's really positive that we found that the vast majority of people surveyed would recommend home dialysis to others. This is of everybody that was surveyed, whether you were on home dialysis or not. So I think it's really interesting that it has a very positive point of view and positive connotation. For patients who are not currently dialyzing at home, we ask them what would make you feel comfortable with home dialysis. The most popular answer here was the addition of a care partner at home. This is really interesting to me because we talk a lot about the importance of care partners, but we're actually seeing it in response to the survey. And so I think that's it to take away and think about for the future as well. There's two more things that I want to share. The next one I think is really important because it's about crashing into into dialysis. Many of us are probably familiar with crashing. That means that you don't know that you have CKD, you don't know your kidneys are failing, and then you end up in the emergency room or some other emergent situation where you find out that you need dialysis immediately. A lot of our respondents noted that they began dialysis emergently and that the first time that they were educated about home dialysis options was when they were in the hospital. And so this tells us that we need to be doing a better job of educating upstream, educating patients earlier. This is really interesting for policy purposes because it's a message that we can take to policymakers about the importance of early education. And finally, even if they were educated late, most patients said they did feel well informed about home dialysis options. So I thought this was really interesting and kind of, helpful to us to know that the education that they are getting, even if it's later term, is really good education. So, like I said, this is just initial data. We're going to be doing a lot more analysis and taking apart what we saw, making sure that we have analyzed it every way that we can, and making sure that everybody has access to what comes out from the survey. So, I wanted to spend just a couple minutes going over some of our past projects because they're still relevant today. A couple of years ago, under our Mitigating Institutional Roadblocks column, we did a PD catheter paper. This was actually a published paper in Clinical Kidney Journal. We at the IHDR supported a group of experts, mostly clinicians, in writing a paper on how to incentivize PD catheter placements, how to make sure that patients are getting access to these procedures and that doctors are feeling confident and like they have the support to perform them. We also brought this group of authors to CMS, the Centers for Medicare and Medicaid Services in the US, to do some advocacy. And that's the group in the US that is responsible for payment for dialysis, both in-center and home dialysis. And so you can see that we took an academic exercise and then we turned it into advocacy. And then our online resource center. Some of you, if you were at the summit last year, might remember me talking about this. We were teasing it. It hadn't been launched yet, but we have launched last year. We are super excited about the resource center. This is a collaborative online library. It's for patients, clinicians, industry leaders, whoever you are, it doesn't matter, you can use it. The purpose is to be able to easily access latest resources on home dialysis and make sure that you are educated and informed. It includes all kinds of stuff. It includes stories, papers, summaries of unique programs that you could use as learnings for future advocacy. Really anything runs the gamut. You probably can find it on the Resource Center. And then this is just a picture of what the Resource Center looks like in case you want to find it for yourself. You can see that some of the articles are on the right side, and then there's a search bar where you can find things on your own. I think that's it for my presentation today. I'm really excited that I got to share with you what we've been up to at the IHGR. Really appreciate the time. And again, thank you so much, Candie, AAKP, and GW.
Thank you, Ms. Seger, for that informative presentation. I would like to ask you a few questions that I have. Ms. Seger, as a longtime ally in the home dialysis space, what do you see as some of the common barriers that still exist in promoting wider adoption of home dialysis options? What and how can they be addressed?
Thank you for this question. It's actually very appropriate because I think it aligns really well with the pillars that we at the IHDR are working under. So I'll just give you a couple of examples. One of the biggest barriers that I see is still this culture of support for home dialysis. I think we have a ways to go in making sure that institutions and governments think about home dialysis when they think about kidney failure, and making sure that patients are able to tell their stories and clinicians are able to bring the clinical expertise that they have to those stories and combine the two into something that's really impactful. I think that's kind of where the magic happens. I think that that is a really wonderful combination that really gets policymakers' attention. Something else that I would point out here is the peritoneal dialysis catheter question. We raised this back in the paper that we did that I talked about before, but I think it is still very relevant. There is still a lack of, in some cases, it sort of differs across countries, but some of the barriers here are a lack of confidence in performing the procedure because maybe clinicians haven't been educated enough, or they need more time practicing this procedure. Maybe it is a challenge with being able to book operating room time because the number of patients is not high enough to really generate that interest or time that is necessary. And then maybe it's a government problem where they are not incentivizing PD catheter placements in the same way that they are incentivizing other types of procedures. And so I think all of those things could be addressed and make a big difference as well.
The theme of this year's Global Summit is Vox Populi. Can you tell us how patients help shape government policies and private sector collaborations to increase awareness and access to home dialysis?
So, the vast majority of my advocacy that I have done directly has been in the United States. So, you'll have to excuse me for having sort of a US centric perspective on this question. But I do a lot of meetings on Capitol Hill, which is our legislative branch, and in the White House or in the administration doing regulatory work. And the number one thing that I am always asked is, do you have patients that can come and talk about their personal stories and how this is actually impacting them on a daily life sort of level? And I think our messages as advocates are only stronger when we have patient voices joining in the chorus. And I think really more so even than joining in the chorus is patient voices should be elevated in the forefront and should be really the first thing that you think about when you think of advocacy is, who does this impact? How does it impact them? And how can I make that clear to a policymaker? What's the everyday impact of, having end-stage kidney disease? And what is the thing that needs to happen next?
Based on your experience working with patient advocates across the globe, how can healthcare policies be shaped by advocates to better support patients from historically underserved communities transitioning to home dialysis?
So I think for advocates who want to make an impact in underserved communities or who are from underserved communities themselves, it's really important to take a step back and say, what are the barriers? Why is this community underserved? What's exactly going on here? Maybe it's a lack of access to broadband. Maybe it's transportation challenges. Maybe it's longstanding sort of socioeconomic or other types of barriers that are, more expansive even than access to healthcare. And figuring out what those are, I think, is a good first step. I think figuring out on a person-to-person level, what are some of the challenges is also really important. Another organization that I worked with, that I still work with, actually did a project with the NAACP in the United States, and we went around to different communities where there were NAACP branches, and we targeted underserved communities, underserved areas for educational efforts. And one thing that really struck me was how much self-advocacy these patients were having to do, and how much fighting they were having to do just to access basic healthcare. And so that gets really tiring, and that's really hard. And I think making sure that we sort of understand where people are coming from and what they need to be successful, it may not be the thing that we, first pull to mind.
On a final note, Ms. Seger, based on what you have seen across the globe, do you think we are making progress during this decade of the kidney to evaluate the voices of patients? What advice would you give to patients and families watching this global summit who want to become more involved in advocating for greater access to home dialysis care?
Really good two-part question. I am really hopeful. I do think that we are making a positive difference in elevating patient voices. Something that I have seen throughout the journey that I've taken with the IHDR is the appreciation of people who have come to our events for bringing patients and clinicians to the same venue and having them actually speak face to face and have conversations and be able to collaborate in a really open environment. And I think that's a huge step forward. I think that's awesome, and I love to see it. What would I say to patients who want to be strong ads? I would say just start telling your story. Seek out organizations like AAKP, like the IHDR, and just start coming. I don't think there is a perfect time to start being an advocate. I think you just start, and it might be challenging and it might be a little hard or a little uncomfortable at first, but it's worth it. And so I would just encourage everybody out there who thinks that they have something to say to just go ahead and say it.
Ms. Seger, we appreciate you being a part of this session for the AAKP Global Summit.